Good day. I am Lesroy Williams. The world is experiencing disruption like it has never seen in a very long time due to the COVID 19 or the novel coronavirus that started in Wuhan, China, or was detected in early January 2020 in Wuhan, China. That virus has now spread to other parts of the world and is creating a lot of disruption. Europe is now the epicenter of COVID 19. Spain and Italy are the most affected in Europe. As of today, Spain had close to 500 deaths and over 11,000 confirmed cases. Italy, there's more than 26,000 confirmed cases and 2,500 deaths. Major disruption around the world. Cancellation of big sporting events, church and school closures, chaos at airports, grounded planes, the cruise industry adversely affected, and so on. It is creating social, economic, and political impact of a great magnitude. Today I have with me in studio the Chief Medical Officer, Dr. Hazel Laws, and the Chief Medical Officer of the Joseph Nathaniel France General Hospital, Dr. Cameron Wilkinson. Welcome.
Thank you for having
Medical
us.
Chief
Good
of Staff.
afternoon.
Medical Chief of Staff. Okay. Now, what is the current situation as it relates to COVID 19 globally and more specifically to our region?
Okay, thank you for asking that question, Mr. Williams. The new coronavirus disease, or COVID-19, as you rightly said, continues to spread rapidly. At present, it has impacted over 160 countries globally. And if you were to say, look at the United Nations, that's about 80% of the United Nations territories, because there are 193 countries that make up the United Nations, and so it's spreading significantly around the globe. Now, over 179,000 persons have been diagnosed with this disease globally, and over 7,500 individuals have died. If you were to work it out, about a death rate of about 4%. Now, let us look at the region of the Americas, in particular, closer to the Federation. All right, so the Dominican Republic has reported 21 cases. St. Martin, which is just a stone's throw away, they have reported 2 cases. St. Bart's have now increased their total to 3 cases. Jamaica, as up to today, 12 cases. St. Vincent and the Grenadines, 1 case. Guyana, down south, 4 cases. Cuba has reported 5 cases. St. Lucia reported 2 cases. Bahamas, 1. Trinidad and Tobago, 5. Antigua and Barbuda, 1 case. Barbados, earlier today, reported 2 cases. And so this provides us a summary of what's happening closer to the Federation. So the virus is circulating the Federation, and so the risk of the virus reaching our shores is extremely high.
As of today, Dr. Laws, people have been circulating on social media via WhatsApp and Facebook that St. Kitts has recorded its first confirmed case of COVID 19. Are you aware of anything like that?
Mr. Williams, at this point in time, it's at the end of the workday, it's almost 4:30 p.m., and we do not have a confirmed case of COVID-19 in the Federation.
As a matter of fact, if it's 2 persons who would know about that is myself and the CMO,
Right.
we can categorically state that we don't have any
Confirmed
confirmed cases.
cases.
It's only a matter of time,
Right.
but we do not have any confirmed cases.
In fact, some people go as far as to say that it has been in the Federation since after Carnival, with people having this bad flu and so on. And they are associating now to say, well, this must have been the coronavirus.
Well,
Okay.
one can speculate as much as they want, but as we said, there are no confirmed cases. I don't know if you wanted to say something.
Yes, I wanted to say that, yes, right after Carnival, that's the first 2 to 3 weeks in January, we did see an increase in numbers of patients with influenza. We need to remember we are still in the regular influenza or flu season. And so that is what was circulating at that time, influenza. Actually, influenza type B,
Right.
not the coronavirus.
Okay. Now, of course, preparedness is key. And we have to prepare. This is a region where we always have to prepare. Every year we have to prepare for disasters and so on. But this is a disaster as well that is taking the world by storm. A health disaster, really, and we have to prepare equally, just as we would have to prepare for a hurricane or even more so. What are our institutions doing to prepare?
Okay, well, I'm glad you asked that question because our preparedness response for COVID-19 aims to address three things. We aim to slow and stop the transmission and prevent outbreaks and delay spread, to provide optimized care for all patients who are seriously ill, and to minimize the impact of the epidemic on the health system, social services, and economic activity. And it's important for me to quote something that the World Health Organization said, and that is that each country should prepare to respond to different public health scenarios, recognizing that there is no one-size-fits-all approach to managing cases of outbreaks of the COVID-19, and that each country should assess its risks and rapidly implement necessary measures at an appropriate scale to reduce the transmission of the disease and also the economic, public, and social impact. Because we see 24/7 on CNN what is happening worldwide or in the United States, and some persons wonder, well, why aren't we doing the same thing? But don't forget, you have to do it based on your economy, based on your scale, based on your population. And so what I want to do is to outline some of the preparedness things that we have been doing for the Federation. Number one, we have a health emergency operating center that is set up at the Josephine France Hospital in the conference room. And once we have an outbreak, this will be manned by persons like myself, the CMO, members of the Executive Management Committee, and other senior physicians across the length and breadth of St. Kitts and Nevis. We have an infection and prevention control guidance manual that was produced by the Ministry of Health, so that we can address every aspect of the COVID disease. If the patients come to the hospital, it goes right through the management protocols, what is done if the person needs to go to the operating theater, how we deal with decontaminating the room, even right down to how you deal with a body that is in the morgue. And so we have a very comprehensive plan that outlines what we would do in a case where we have an outbreak. There is a helpline that is being set up. You can tell us more about the helpline, Doctor.
Yes, so the Ministry of Health is collaborating with Flow. We've approached them and they consented to giving us a helpline. The number is 311. I'm sharing it with the general public. However, it's not launched as yet, but it will be. And so individuals who maybe, when we would have announced our first case and when we're in local transmission, individuals who would be impacted by the virus, they may have questions and they are free to call the helpline and they will be directed accordingly.
But what I've told our doctors also is that every doctor's phone, every doctor's office number is a helpline also, because one can call and get information. And as we educate the public, I mean, your telephone might be a helpline also, because whatever information you know about this, you can share it. And so we all need to be playing a part in trying to control this.
And I want to add, because this virus is highly contagious, individuals who are coughing and sneezing, it's actually advised that they could call their doctor ahead of going into the practice, because you want to limit the number of persons who you expose to your respiratory droplets. And so individuals we would want to recommend that they call their private doctor's office before actually going in, because the doctor could actually speak to them on the phone and make an assessment and direct them accordingly.
Yes. Now, we have been having regular public service announcements to educate the public about the disease. The Ministry of Health and the government have been having regular press conferences so that we can address the problem and educate persons. The health centers, we would be reorganizing the schedule in the health centers, where we would be having the regular clinic patients coming in the morning and the flu clinics in the afternoon, because we all know that the persons who are most at risk are the elderly with pre-existing conditions. And most of the persons who are seen in the health centers are persons with diabetes, hypertension, coronary artery disease. And so we'll be making an attempt to separate these persons. So if you know that you have a flu-like illness, you will go to the clinic in the afternoon, so that the persons with the chronic diseases, they would be seen in the morning. There is also a COVID reporting form where, if, for example, a physician has a suspect case or confirmed case, this form will be filled out. And this can help us in terms of tracking the contacts and reporting the information to the World Health Organization. Any more you want to say on the COVID reporting form?
No, I
No.
think you
Yes.
covered it. Yes.
Okay. Now, one of the things that we have seen in a number of the countries that have been hit hard, and it's important for us to learn from other countries, is that some of them have drive-through clinics for testing, etc. And what they attempt to do is to separate these persons from the regular patient population. And what we have done, if you were to drive to the Josephine France Hospital now, you will see there's a tent that is set up just outside of the emergency room, where we'll be seeing patients with flu-like illnesses during the day. So if you have a cough, cold, and you think that you need to see a doctor, you don't need to go and sit and wait for hours in the emergency room, mingling with other persons, putting yourself or other persons at risk. So these persons will be seen in that clinic that is set up just outside of the hospital. And if the situation, God forbid, gets worse in the Federation, we'll actually be setting up more of these clinics or tents, in populations that are hit hard. So persons won't have to leave their village and come to the hospital. They can get their treatment or their advice right in the community where they are. Now, persons who are symptomatic, or persons who were confirmed, or persons who are asking, well, where would these persons be treated? They will be treated at our hospital, the Josephine France Hospital. So once we get our first confirmed case, these patients will be managed at the Josephine France Hospital. And suspect cases, they would be quarantined at home or at a Ministry of Health facility. Now, you might ask where in the hospital we'll be doing this. Once we get our first confirmed case, we will command the private ward, where we have about 17, 18, 15 beds, private beds. And that is where we would be looking after these patients. Of course, if it gets out of control, we would command more and more wards. And if it becomes rampant, as it is, for example, in Italy, which I hope not, then we would go into an emergency situation where we'll stop our elective surgeries, etc. And we'll command more and more of the institution to manage these patients. Now, we also have a number of doctors that are deployed on different services, and as the need arises, we will be deploying these doctors into the emergency room to aid with the increased load of patients that we may have if we have an outbreak. The lab, we are attempting to increase the capacity of the lab so that they can deal with the increased routine testing, not just the testing for the COVID virus, but once persons get ill, they will require other investigations, to check their kidneys, liver function tests, etc. And so we have increased the capacity of the lab to deal with that. Some persons ask about staff. We might have an increased need for staff, and so we will be recruiting from the retired nursing population to help if the needs arise. And we also will be looking overseas to recruit critical care nurses and doctors who are specialized in critical care so that we can address the crisis. education is a very important part of the management, and we've been having continuing medical education sessions from the very first time we heard about the outbreak in China. We have been educating our doctors, nurses, and we're educating all level of staff, because don't forget, you can have a breakdown in the infection barrier from a doctor, a nurse, somebody who is cleaning the operating theater, somebody who's working in the mortuary. So we're having continuing medical education sessions for all levels of staff so they can stay abreast with the information that is available. We also, Dr. Laws will tell you that we've been taking these education sessions out to the businesses
Yes,
and the
yes,
schools.
yes.
You want to make a comment on that?
Yes, we've embarked on a massive education campaign. So that's the Ministry of Health in collaboration with the COVID-19 National Task Force, which is headed by Mr. Abdel Samuel, the National Disaster Coordinator. And so to date, we've visited a number of private sector and public sector entities. And the aim is to empower individuals in terms of what they can do to prepare themselves and their organizations and families for the onslaught of this virus.
Yeah. We also have plans to go into the prison so that we can
Yes.
educate the prison population about this. And once we have confirmed our first case, we would be shutting down an institution like that to visitors, because you don't want the virus to get in there,
Reintroduced into
be
that
introduced into that
population.
population.
Yes.
We're also taking this CME program to a number of nursing home facilities, our carrying home and private nursing home facilities, because these are the persons who are vulnerable, and it's important for the persons working with these people to be aware about the disease and how they can address it. And we are increasing our capacity to deal with the disease. So we're going to have an increased supply of nebulizers, so we can increase our nebulizing capacity for all of our institutions, the 3 hospital institutions and all of the clinics. So if you have any difficulty breathing, etc., you can be nebulized. We will have an increased number of defibrillators. We have an increased number of portable X-ray machines, so that if we have a COVID positive patient, they don't necessarily have to be pushed all the way down to the X-ray department to have a chest X-ray. The X-ray would be done right in the person's room, so that helps to limit the spread. We also are going to be having an increased number of ventilators, so that we can address persons who develop respiratory deficiency. We also increasing our oxygen supply at the hospital so that we don't have any shortage of any of these things. We also have an increased number of personal protective equipment, you know, the N95 masks, the gloves, aprons, etc. And lastly, sometimes persons ask about testing. Mm-hmm. Testing is available. We have an increased number of kits available for testing.
Mm-hmm. All right, so in terms of testing, the Ministry of Health has developed a testing algorithm to guide the doctors and the nurses in terms of if there is a potential case or a suspected case, they're going to ask the relevant questions. And once the individual meets the case definition, the Ministry of Health has to be informed if it's a suspected case, and the relevant samples are taken off. It's really an oropharyngeal or a nasopharyngeal swab, and in some instances a blood test.
Which in simple man's term means a swab from the nose.
Nose and mouth, yes. Yes, from the back of the throat and mouth, and then it's transported in the appropriate medium, and then it's sent first to the Caribbean Public Health Agency lab, which is the official lab for the Federation. It has a longer turnaround time, and so there is a local lab, a next generation medical laboratory that provides us local testing capability. We've utilized them already, and the turnaround time is less than 1 day.
So you can get the results in less than 1 day.
Yes, in less than 1 day.
Yes, and I want to further emphasize that point, because we're actually lucky here that we have a local lab that can do the testing also. So once a person is suspect, 2 samples will be taken. One will be sent to CAFA, and while we're waiting for that, we can get an immediate result here from the local lab, so we can start putting our contingency plan in place.
And managing the patient appropriately, because you will have an idea as is it a case or not. And so you could channel the patient appropriately.
Right. Now, in terms of ports of entry, of course, travel has been, you know, really disrupted
Yes.
all around the world,
Mm.
and people are trying to see how they can protect their borders,
Mhm.
how they can secure their borders, because no one wants this people coming into their country who are infected with the COVID-19. What is being done at our ports of entry?
Okay, so we've increased surveillance at our ports of entry. So let's start with the airport. All incoming air travelers, you must complete the immigration form, but particularly question 17, where you have to declare those countries you would have visited over the last 6 weeks. And if you would have highlighted those territories or countries that have confirmed cases, and in particular local transmission. So right now, Italy, the United Kingdom, France, Spain, and even the United States of America, for example, New York City, California, and the Washington, D.C. area, to just name a few, you will be directed to the health desk at the airport. And we have a very robust screening tool whereby we try to figure out or determine your risk of exposure to the virus. And depending on your score, if you are deemed risky, you will be quarantined. But then if you are of low risk, you would be allowed entry in. And so we've had to quarantine a number of individuals. But let me explain quarantine. Quarantine here means that those individuals they are not exhibiting or manifesting any symptoms, no fever, no cough or anything. They only have a travel history of possible exposure. And so we do not want to take any chances. And so what we do, we limit their movement, and we observe for the onset of signs and symptoms. So they are quarantined for about 14 days, just to ensure that we would not have imported a case.
And just before you go on to quarantining someone doesn't necessarily mean that they're locked away in an apartment, because sometimes they get called about a person who is suspected to be quarantined, and somebody might say that they saw them on the beach. If you're quarantined, you can sit and look out at the Atlantic Ocean, because the person who is in front of you are thousands of miles
Miles away.
away on the other side of the Atlantic. And so it doesn't necessarily mean that
You have to be
you
locked
have
away
to
in a
be
room.
locked away in a room.
You're restricted in terms of interacting with other humans, close
You're
distance.
restricted in terms of your movement.
To a degree, yes.
Yes, and you're
In other
monitored, yes.
words, the restriction is interaction and contact with other individuals. That's the restriction.
Okay, and then
Yes.
we hear this term all the time: self-isolation.
Mhm.
The people in isolation. What's the difference between
Okay,
that and
well,
the quarantine?
let me first differentiate isolation from quarantine. Isolation means you are ill, you are exhibiting symptoms, coughing, sneezing, and you have some of the symptoms of COVID-19, and so you have to be. So if you are mild, if you have COVID-19, if you are diagnosed with it, and you're exhibiting, fever and a mild cough, you are deemed mildly ill, and so you can be isolated at home, because all the patients cannot be accommodated at the hospital. All right? So you'll be isolated at home, meaning you are restricted in your room and away from the other members of your family, so that you reduce the risk of passing on the virus to your loved ones.
You cannot share a bathroom with someone else.
You can,
You can, but
but
you
you
need to.
practice infection. When you disinfect, you go in, you disinfect, you shower, and then you disinfect after you would have bathed, and then you go back to your room. The other members of family who are well and not yet infected, when they go into the bathroom, they also need to disinfect to ensure and make sure the surfaces are free. Shower, bathe, again disinfect after themselves, and then you can share a bathroom, and you can do that for 2 weeks without transmitting the infection.
It's better if
And
you have
just,
your own bathroom.
Yes,
yeah,
it's
but
better, but it's not
yes,
always
Yes,
practical.
just to
Yes.
speak some more on that, because there is a lot of misunderstanding in the general public. And so somebody who is being quarantined, we are preventing them from unknowingly spreading the virus, just in case they may happen to be positive while we're observing them for the period of time.
Mhm.
Whereas somebody who is confirmed to have the disease, we are
Isolate them.
putting measures in place to isolate them, to definitely prevent them from spreading it to either the healthcare workers or family contacts or persons who happen to come in close contact. And although, for example, you might have a husband and wife living in a house, it doesn't necessarily mean if the husband gets it that the wife should. And so we would discourage them from using the same utensils, sharing towels, etc., and putting measures in place to decrease the transmission.
And I want to add, just for clarity, persons who are diagnosed with COVID-19, if they are severely ill, they will be isolated in the hospital setting on the private ward, and they will be provided adequate care. Yeah.
Now, what should someone look for in terms of symptoms to kind of alert them whether they should check a doctor?
Okay.
Basically, the symptoms.
Okay, so very good question. Because if we're in an outbreak, you need to know if you are a suspected case or not. And so the most common symptoms of COVID-19 includes fever, a dry cough, and shortness of breath. And this is the evidence coming out of those areas that are already impacted. So it's fever, a dry cough, and shortness of breath. The other symptoms can include muscle aches and pains, conjunctivitis, redness of the eyes, yes, and
General
vomiting and diarrhea, gastrointestinal symptoms.
Okay.
Yes.
Now, we have to remember, though, that persons have been coughing and sneezing for thousands of years. And so it doesn't necessarily mean that if somebody coughs or sneezes now, they have COVID-19. I was in the supermarket the other day, and a poor lady coughed, and the entire lane was cleared just because she coughed. And so the patients need to know, too, that just because you have a cough or sneeze, it doesn't necessarily mean that you're infected. And that is why, though, we're encouraging persons to call as opposed to coming in, because you could have a cough or sneeze that is totally unrelated to COVID. You come to the hospital where a lot of persons are being treated, and you can get infected. And that's why we're trying to manage most of these persons outside of the hospital.
Dr. Wilkinson, I suppose a lot of what you just described is created by fear, the fear surrounding the COVID-19. People are not really sure, and so on. And that is something that has to be addressed as well. The panicking, the fear, sometimes the fatigue, probably the mental stress that comes with all of this, because we have to deal with that too. I mean, I don't think there's any health without mental health, really.
Yes. Well, there is always fear of the unknown, and that's one of the reasons why we are here to educate the public, because education is a powerful thing, and empowerment. And so once you have the knowledge, then you would know how to address it.
And then you can approach it calmly,
But what would be some of the tips concretely that you can give to people in terms of how to approach this new virus, in terms of what can they do for their own mental health? Because as you said, somebody coughed in the supermarket or sneezed in the supermarket and everybody clearing out. But we've been coughing and sneezing for centuries.
Yes. Well, it's important first to know, first of all, that 80% of the persons who get it would have little or no symptoms.
And they recover without any complications.
And they recover without any complications. So it is not a death sentence. Okay. About 20% of the persons might have a severe disease, and the death rate so far is listed as about 4%. But again, it could be much lower, because as we do more testing, we would know those persons who were infected with the disease, and therefore we would have a greater numerator over the denominator, and so the death rate would actually go down. And so there are some persons who think that the death rate is actually lower than 4%. But basically what we're saying is that it is not a death sentence. And the preponderance of persons who are dying are those who are older and with pre-existing conditions. It doesn't necessarily mean then that somebody who is younger cannot succumb from the disease. But if we educate persons, if we try to decrease the spread, if we try to protect the most vulnerable in our
We
communities,
will do well.
then we would do well.
I also want to add that it is not very prevalent amongst children, because when you look at the number of cases in China, only about 2% were below the age of 19 years. And so, and for me, that's very reassuring. And they tell us that the few children that have been impacted, they just follow a mild course of the disease. And so for me, that's reassuring.
Right. Now, the stress that is brought on by the economic fallout with this COVID-19, cruise ships not coming, flights are, now reduced. Our industry which we rely on heavily is that of tourism, and so therefore many people in that sector are going to feel the brunt of the impact of this COVID 19 and stress.
Yes.
And stress is not really good for one's health either, because stress can affect your immune system, from what I understand
Yes.
as well,
But-
which makes you even more vulnerable.
But that is why the World Health Organization says that there is no one size fit all. And for each country, in addition to trying to contain the disease, you have to take into consideration what your actions will do on your economic, social, and mental activity. You understand? Because the easiest thing for us to do is to say, we're going to stop our flights, we're going to close down our borders completely and make sure that the virus doesn't get here. But what impact that would have? And so
Striking a
sometimes
balance.
we have to try and strike a balance. And we can't just take draconian actions and decide we're going to, let's say, for example, the government decided today to close down all the schools. These children have parents who are working, and we have to take into consideration what would happen to these parents. It means that most of them are going to be leaving the jobs. And so there's a delicate balance that has to be tread. But the most important thing is that the safety and security of the nation is always paramount.
Yeah, we're hearing a lot about social distancing. That has become the new term now, social distancing. What does social distancing entail, and will it be something that we recommend at this time?
It's one of the tools that public health practitioners use to contain an infectious disease outbreak. And it really involves reduction of mass gatherings. So in other words, if you have a sporting event, or even, you may control cinemas, because these are areas where a large number of persons gather together and they're in close proximity to each other. And so social distancing means you employ measures to reduce large crowds, whereby you have persons, coming very close to each other. All right, and so that means banning parties, fetes, large sporting events. Even it may even affect church.
Yes. But one of the things we have to know, though, is that the virus is not just floating around in the air. It is
Right.
traveled via droplets. And so if you can stay at least 6 feet away from someone, even if they cough or sneeze, the virus will not get to you. Because there's some persons who think that, well, they just need to wear a mask because the virus is floating around in the air and they're trying to prevent it from getting to their nostrils. That is not the case at all. And so social distancing also includes just keeping a certain distance
from persons.
from our persons.
Yeah.
And not just because somebody has the virus doesn't mean that you can't be in the same general location if they happen to be walking, going. But once you maintain your distance so you're away from the droplets, then you'll be fine.
So what are some hygienic practices that people can get involved in to help prevent?
Okay, so what we are promoting is hand hygiene. Really, the literature tells us that hand hygiene is the best defense against this new coronavirus. And so we are asking persons to wash your hands thoroughly, front, back, and in between for longer than 20 seconds. Good old soap and water, because I think the hand sanitizers now, the alcohol-based ones, are very scarce on the market.
And a bit pricey.
Oh, okay, fine. And so washing your hands, maintaining clean hands, after coming through closed doors where you would have touched contaminated door handles, etc., you need to keep your hands clean. Yeah, and also not to place your hands in your face, your eyes, nose, mouth, because then you run the risk of introducing the virus into your bloodstream. So hand hygiene is one of the main things that we are trying to promote.
You know, and what's interesting is this: as a developing country, sometimes you hear people criticizing our healthcare system as it relates to fighting certain diseases, complain about the fact that, well, we may not have enough MRIs or CT scan or robotic
The technology.
technology, etc. But this is a disease that requires simple things to control it.
Precisely.
You understand? And so everything that is needed to control the spread of the disease, we have it here. Okay? And so
And it's not the system; it's the individual action, because it's you and I washing our hands, avoiding individuals who are coughing and sneezing and spreading the virus, and not greeting with contact, not hugging, kissing, and avoiding touching others. These are the little steps that you and I can employ to reduce the number of persons that are impacted by the virus. So, yes, the system, persons are criticizing the health system and its level of preparedness, but in fact, each of us have a responsibility to help to contain this outbreak. And you know what? We need to boost our own immune system so that our bodies function optimally to fight off and stave off the virus. And so we can start now. So instead of, running on the supermarkets and buying a lot of toilet paper, we can buy the vitamins, the multivitamins, the vitamin C, the fruits and the
and
vegetables
eat
with the
healthy.
natural vitamin C and antioxidants, boost our own immune system to fight off the infection. And then we can all be in the 80% whereby we just recover without any complications.
I also think too that each of us have a responsibility to stop the misinformation. And so if you receive a WhatsApp message, a text, etc., about information that you know is false, you just need to kill it, delete it, don't pass it on, because you spoke about people's mental health. There are some persons who are very fragile and they believe everything that is written. And that's why we're trying to educate the public. And the message doesn't have to come from the CMO. It doesn't have to come from the medical chief of staff. It can come from someone who is listening to this program and who is educated about it, and they can spread the information on to others, you
So
know.
we actually have a moral
Yes, we
responsibility
do. We do.
We do.
not to
We do.
spread, misinformation, especially at a time like this.
Yes.
We also have a moral responsibility to look about the most vulnerable
Of course.
among our population.
Yes.
That is a moral responsibility that we have, and probably people don't see it that way. It is not a joke. It is not a prank.
It's very
it
serious.
is
Yes,
very,
very
very
serious.
serious.
Yes, and the other thing is too, we all have to fight this collectively. It can't be you doing your own thing over there and we doing our thing over there. Of course, the Ministry of Health is responsible for the health of the nation. And if you have a suggestion, some advice that you think that we can improve upon what we're doing, then come to us and let us know, and we will add it as part of our preparedness plan. But it is not to go on some other forum and just negatively criticize what we are doing. We need to fight this together because this virus doesn't know age, gender, sex, political affiliation, race.
Doesn't differentiate.
And
It
it's
doesn't
going to
differentiate.
impact, when it gets here, it's going to impact our society like nothing else. It's going to impact the health system, the economy, the social structure as we know it. And so our behaviors and our lifestyle as we know it is going to change somewhat. And we are trying to predict it and to mitigate against the negative impact. And so I don't think we should add to it by, spreading misinformation.
Yes. And I can tell you to Lesroy, I am actually in a chat with persons from my medical class, the class of 89, and this is about 107 doctors who are spread all around the world. And sometimes when I hear about some of the confusion that exists in some of the first world countries that they are in, and I see our level of preparedness, I say that we are fortunate that we have been planning for this, and hopefully we will mitigate against all of the negative things that happen in places like Italy, etc. I'm hoping that we do not reach to that stage, but I believe that we have a level of preparedness, and from what we outlined just now, I believe that the nation should be reassured that we have been working. We can't come to the mic every 5 seconds to tell you what we are doing. Sometimes we're up late at night, the CMO and I, the ministers, sharing information, going back and forth, etc. We can't be in front of a TV screen every single day, but everyone who gets this information, they can be an advocate and make sure that they spread the word and educate, so the least among us will also know what's going on.
So there's no need to panic.
No, there isn't, because I think we have done our very best in terms of ensuring the highest level of preparedness for the Federation.
Yes, I don't think there is any reason to panic at all. We have prepared for the worst case scenario. Let's hope that we don't get to the worst case scenario, but if we have prepared for the worst case scenario, anything in between we should be able to handle. And therefore, there is absolutely no reason to panic, and we'll continue to work to contain this disease. I don't think that we're going to remain case free. There's going to come a point in time when we'll have a first case, and even when that is announced, if it happens, there should be no need for panic. It was only a matter of time. There is no reason why all the countries that Dr. Hazel Laws listed out across the Caribbean, why they would have cases and we would be spared. There is regular travel between a
That is
number
correct.
of these.
And so there is no need to feel overconfident.
No.
But we have to be in a state of readiness.
Yes.
Which we are.
Yes. And what we are doing at present is we are looking at those countries who are ahead of us and who have cases and in local transmission, and we are looking at the best practices. What are they doing? And if it's working, okay, can we adopt it here? So, it helps us to even be, at a higher level of preparedness. And if they made mistakes, we know that's a don't.
Right.
Yeah. So that's what we are doing. We are being very proactive, actually, in the Ministry of Health.
Well, Dr. Laws, Chief Medical Officer, and Dr. Cameron Wilkinson, Medical Chief of Staff at the Joseph Nathaniel France General Hospital. Thank you very much for coming and sharing about something so important of how we can prepare, how we can prevent, how we can mitigate against the COVID-19, the novel coronavirus. It didn't start with us.
No.
It started all the way on the other side of the world in China. But it goes to show how we are so interconnected and interdependent upon each other. That one thing happens to somebody on the other side of the world, and it can have ramifications on the other side of the world. And so we all have to be aware. Thank you very much.
Thank you for having us. Thank you.